Endometrial cancer is a type of cancer that begins in the lining of the uterus, known as the endometrium, and is chiefly encountered in postmenopausal women. The most common symptom of endometrial cancer is abnormal vaginal bleeding, such as spotting between periods or postmenopausal bleeding. Other signs may include pelvic pain and pain during intercourse. In the early stages, individuals may not notice any symptoms, which is why any unexpected changes in menstrual patterns or vaginal discharge should be promptly discussed with a healthcare provider. Treatment for endometrial cancer often involves surgery to remove the uterus and may also include radiation therapy, hormone therapy, or chemotherapy, depending on the stage and spread of the disease. Risk factors for developing endometrial cancer include obesity, a history of hormone replacement therapy, and genetics, such as having a family history of the disease or inherited conditions like Lynch syndrome. Here's a deeper dive into the detailed aspects of endometrial cancer for those seeking more information. Symptoms and progression of endometrial cancer. Symptoms of endometrial cancer primarily manifest as abnormal vaginal bleeding, which can range from watery, blood-tinged flow to more profuse bleeding, often prompting medical evaluation. Postmenopausal women are particularly at risk, as any vaginal bleeding should be investigated. Other signs include pelvic pain, pain during sexual intercourse, and unexplained weight loss, although these are less common. Progression of the disease can lead to worsening symptoms and may involve the spread of cancer cells beyond the uterus to the lymph nodes and distant organs, a process known as metastasis. As the cancer advances, complications like anemia from chronic blood loss or the impact of metastases on other organ systems can significantly affect a patient's health and prognosis. Early detection significantly improves outcomes, highlighting the importance of recognizing symptomatology and seeking timely medical advice. Diagnosis of endometrial cancer. The diagnosis of endometrial cancer, a common gynecologic malignancy, is critically dependent on early detection for optimal patient outcomes. It primarily involves a comprehensive approach that includes patient history evaluation to check for common symptoms like abnormal uterine bleeding. Diagnostic procedures often start with a transvaginal ultrasound to assess the endometrium. If abnormalities are detected, a biopsy is the gold standard to make a definitive diagnosis. Advanced imaging techniques like MRI or CT scans can further delineate the extent of the disease, guiding treatment planning. Timely and accurate diagnosis affects treatment options, which can range from surgery to radiation and systemic therapies, highlighting the importance of recognizing and evaluating endometrial pathology early in its course. Cause and risk factor of endometrial cancer. Endometrial cancer, emanating from the inner lining of the uterus known as the endometrium, is primarily instigated by hormonal imbalances, specifically an excess of estrogen relative to progesterone. This disproportion can stem from obesity, which augments estrogen production, polycystic ovary syndrome, PCOS, or hormone replacement therapy, HRT, that doesn't adequately counterbalance estrogen with progesterone. Age is a significant risk factor, with a majority of cases arising in postmenopausal women. Genetics also plays a role. Hereditary non-polyposis colorectal cancer, HNPCC syndrome, heightens risk. Hypertension and diabetes, notorious for their vascular impact, are also implicated as they may disrupt normal hormonal functioning, creating an environment conducive to cancerous growth within the endometrium. Treatment and management of endometrial cancer. The treatment and management of endometrial cancer are multifaceted, often influenced by the stage, histological type, and patient-specific factors. Current modalities include surgery, typically a hysterectomy with removal of the uterus and ovaries, which can be curative in early stages. Advanced cases may require adjuvant therapies such as radiation to destroy residual microscopic disease. Chemotherapy is employed for metastatic cancer or aggressive subtypes, while hormone therapy targets hormone receptor-positive tumors. Immunotherapy is emerging as a promising option. There's a growing emphasis on personalized medicine and potential genetic profiling to tailor treatments, improving outcomes, and reducing side effects for patients with endometrial cancer.